Hello and welcome back to another Sana Institute 10-minute training. I'm Dr. Rob Van Bergen, and today we're going to be covering the idea of combining different therapies and in turn creating a multifaceted approach to holistic healthcare. Firstly, we're going to talk about some combination therapies that I have seen and the efficacy of them. And then I'm going to talk about a way we can incorporate some manual therapy directly into the microcurrent protocols we do. Now, probably at the top of the list of combination therapies, and arguably not really a manual therapy at all, depending on how you want to perceive that, sits acupuncture. Now, there's been a growing interest in the included expansion of our microcurrent devices with direct use in acupuncture point stimulation, but not just the way we teach through the pencil electrode. In fact, skilled acupuncturists have been using needles still in combination with microcurrent, and this has been going on for a very, very long time, but the popularity is only increasing. So by simply using something as simple as the Genesis device, so that they can utilize the modes in this, they're able to connect up to 4 needles to the device with a specialized damping wire that we've developed. Now, this is important because the needles bypass a lot of the skin's resistance. So when you're dealing with microcurrent and you're letting it just pass through much of the skin with the needle, it's going to cause some discomfort. So this specialized damping wire that is only available for special order, you can't actually just buy it on the store. You have to contact us for it. This allows you to lower the intensity of the device so much that it supplements for the needles bypassing the skin and makes for a comfortable, if somewhat, sometimes imperceivable treatment with the acupuncture needles and the microcurrent combo. So from the reports I've heard, this dramatically enhances the effects of the point stimulation. And moreover, beyond just the impact of what that 1 or 4 points would normally achieve, there's a more holistic health effect that really dramatically impacts the body's electrical system and therefore its ability to heal, because they're able to get right into those energy channels and correct many of them with that traveling electricity. Now, what about more manual types of therapy? So there's lots of these out there, and I'm just going to use a few examples. Processes like a manual cervical traction, which will mean kind of the stretching of the spine, usually very gently, to reduce tension in the neck. Processes such as massage therapy, this should fall into that category as well. People using their hands to relieve pain and promote relaxation. They can benefit from a combination of microcurrent as well. In fact, even stuff like chiropractic adjustments, which may be considered a bit more dramatic because there's a physical change in the cervical shape or pattern, these can benefit too. We're going to talk about little ways why. Now, we can view each of these individually, like we can just say, well, this is going to do this, this is going to do this. But the truth is that microcurrent is going to be working to do very different things depending on what you want to achieve as a result of these treatments. So, for example, deep tissue massage can sometimes release toxins. So maybe elimination assistance before a deep tissue massage will assist with that process. People that get these deep tissues sometimes can come home feeling very crappy and have a detox reaction, and this could avoid that. They can also sometimes cause a little bit more pain because you're having to really get in there and kind of pull and break apart these this inflammation and get things pulled so that the body can relax. So in the short term, they could create more pain. And again, in these cases, reducing that inflammation can go a long way towards a smoother healing experience. Now, manual adjustments can have their longevity altered by tense muscles as well. Weak muscles even are another issue within the body that simply stops it from being able to retain its proper structure. One example that comes to mind all the time for me with these adjustments is scoliosis, right? A chiropractic adjustment could shift that scoliosis curve, but it might not hold before falling back into old habits. The body is a creature of habit. Combining this adjustment with microcurrent therapy could allow for the body to strengthen the muscles in the right place, holding the spine kind of straight where it should be, right? And essentially retraining the body. Now, of course, your ability to enact with these therapies and put them in your practice is entirely dependent on your scope. A massage therapist is able to work on the body with their hands. They're able to apply massage techniques. But someone who is a board-certified holistic healthcare practitioner, as through our program, is not able to do that. So you can do the microcurrent, but your hands, you're not trained in that manipulation. An acupuncturist can use needles. Again, an HHP cannot. So it's going to depend on what skills you have got your certifications in as to what you can legally use in your practice. So just be aware of that combination of skills from multifaceted avenues, because this is going to expand your repertoire of tools. So as we breach into different areas of education and we learn different things and we get certified in different things, it expands our capacity in what we can do for our clients. Lastly, for anyone looking to actually get some manual motion of microcurrent and benefit from that therapy with a little bit more pressure, there is something to that as well, particularly with the massager electrode, which I do not have. I actually had someone come to our office and they wanted one so badly that they took mine because we don't have any in stock at the moment. So I will replenish mine in a few weeks when the new ones come in. But the massager electrode allows us to place considerable pressure on the tissue and to be able to release some of that tension, because you hold it in your hand so you can get it in there and you can apply that pressure with your hand as well using the microcurrent. So this improves, there's a bit of a release in doing that. You could also do the same thing with the Y electrode, but truly when you experience the difference between the two, it's night and day. The massager is so much easier to get that pressure on. Though you can try this with the Y electrode. But there's a difference between that smooth glide of not putting much pressure and putting that pressure into that sore area to try and relieve some of that tension. So you can certainly combine it with that. Is it going to have the same effect as like a deep tissue sports massage? Probably not. That's left to be seen. It's going to depend entirely on a case-by-case basis. But utilizing your microcurrent tools with a bit of pressure can help alleviate discomfort and push through some issues that we might otherwise find very challenging to overcome. Now, I believe that the trick to all of this is to look at your repertoire of qualifications and to find unique ways to combine them. There's incredible power in many of these holistic therapies, and they seem to only enhance one another. Whether it's manual therapy or not, we can easily see the benefit that exists in the combination of microcurrent, PEMF, scalar, even light therapy. We know different therapies complement, but they don't replace. It's always good to look at the bigger picture. So thank you everyone for joining me today. I hope you enjoyed this. I'll see you next week for another 10-minute training. For those of you listening and attending tomorrow's open house events, I look forward to seeing you there bright and early in the morning. Take care, everyone.